Today we will talk about a topic that has become increasingly popular in recent years. Does silicone injection into the penis really work? There are many claims about this on social media, but most of them are far from a scientific basis. Silicone is actually a material designed as a soft tissue filler, and although its use for penile enlargement does not seem to be a method recommended in medical guidelines. The reason is that the area where the injection is performed is a very sensitive region full of blood vessels and nerves. After it was done, it was observed that patients were very positive psychologically. First of all, patients reported an increase in self-confidence and the formation of a strong bond with their partner, and they stated that width, not length, produced more striking results. To share the results seen in scientific publications in a simple language. If you are considering such a procedure, or if there is someone around you who is curious about this topic, what you are about to hear will serve as a real filter in the decision-making process. These informations were taken from 3 different academic articles. Whether silicone injection is safe is a frequently asked question, but the answer is clearer than you might think. No, it is not considered safe. Because the majority of these injections are performed by non-medical individuals in non-sterile environments. This means that what kind of silicone is used, how deep it goes, and whether it mixes into the blood vessels is often unknown. In scientific cases, complications such as swelling, subcutaneous hardening, and fever that begin immediately after the injection are frequently observed. In some cases, silicone can enter the bloodstream and lead to much more serious consequences. In the medical literature, it is stated that this practice carries unpredictable risks even in controlled environments. Therefore, there is no solid evidence in our hands that this method is safe. One of the most frequently asked and most important questions is this: what kind of complications occur after silicone injection? In scientific reports, the most commonly seen issue is what we call a granuloma, a foreign body reaction. In this situation, penile tissue becomes hardened, irregular masses form, and over time it becomes painful. In more advanced cases, necrosis, meaning tissue death, can develop. This can progress to a severe condition in which the upper skin of the penis is completely lost. Infections are also a serious risk, especially in underground procedures. Bacteria can settle around the silicone and cause widespread inflammation. This situation can lead the patient to long-term surgical procedures and tissue loss. In other words, the problem is not a side effect of a drug, but the material itself directly causes the issue. The most critical question on the mind of everyone considering this procedure is, will my erection be affected? Unfortunately, when we look at scientific cases, the answer is often yes. This is because silicone can compress the blood vessels and nerves inside the penis. An erection occurs when these vessels fill with blood in a healthy way. If the silicone spreads irregularly, this mechanism is disrupted. In some cases, erections have completely disappeared, and in other cases it has been reported that sexual intercourse became physically impossible. So while the goal is to increase performance, the result can be the exact opposite. Moreover, this impairment may not be reversible. For this reason, before the procedure, the question, "What can I lose?" becomes more important than "What can I gain?" Of course, this also means that premature ejaculation is prevented. People think that silicone will be absorbed by the body over time. This is incorrect information. Silicone is permanent. The body cannot dissolve it or break it down. This means that the resulting deformities, hardenings, and granulomas do not resolve on their own. While some people wait thinking it will melt over time, the problem can actually worsen. Moreover, silicone may not remain in one area. It can migrate between tissues and spread to other regions. This situation leads to larger deformities and more complex surgical procedures. In other words, once silicone is injected, the path back is most often the surgical table. For this reason, thinking about this procedure with the mindset of "I'll try it, and if it doesn't work, I'll remove it" is dangerous. Many men consider this procedure to improve performance. But in one aspect, it helps prevent premature ejaculation. After silicone injection, loss of sensation occurs. Because silicone puts pressure on nerve endings and creates long-term hardening in the tissue. Maintaining an erection also becomes more difficult. This situation creates not only physical, but also psychological pressure. So while the goal is to increase self-confidence, the result can turn into a loss of self-confidence. Of course, on the other hand, when everything goes positively, partners say that width is more important than length. I will answer this with a study. You can see these studies from the articles in the link below. 324 men were examined, and the following were reported. An average increase of 27% in penile circumference was achieved. The procedure was not surgical and was performed under local anesthesia. The individuals were followed for 20 months, and no serious complications were reported. Patient and partner satisfaction was high. Some patients reported improvement in erections, prolongation of premature ejaculation duration. I can make 2 to 3 more videos about this topic. Nowadays, the number of people getting silicone injections is steadily increasing. I will provide you with all the necessary sources so that you can make an informed decision. Yes, there is a volume increase after the injection. Everything I explained in this video is based on real cases published in peer-reviewed journals. If this content informed you, you can leave a comment, like the video, and subscribe.